Today, I have the honor and the privilege of having a good friend of mine on, Yasmin Kottait, all the way from Dubai. How are you doing, Yasmin?
Hey, Jeff, thank you so much for inviting me. You're the best.
Dr. Kottait is a pediatric dentist. She's one of the owners and actually the founding member that brought the pediatric part to a clinic in Dubai called My Pedia Clinic. She's also a Sprigg University instructor. What was your journey like that led you to working with Easy Crowns? What was it that brought you to that realization in your professional practice?
Jeff, the first easy crown I've ever seen was 2015. I was a recent grad, and I just happened to work at a clinic that offers them. And they were these old big kids. And I had a child. She was 4. She's very cooperative. She's a very sweet girl, and she had bad teeth. And her mom was super unhappy with the fillings coming off, and they were terrible. And I didn't know anything about white crowns then, but I saw this and I was like, you know what, I really want to be the doctor that gives this beautiful smile to this girl. I had YouTube then, and usually in my lectures I showed the first 2 crowns that I ever placed. They don't look great. They're malaligned, and it was the best that I could do in 2015 with these crowns. And these were the first crowns I've ever used, and they were just beautiful. The child, she cared it was white. The mother cared that it was like that they were white, and later all the family came and were my patients, and they were just raving and raving and raving about the new cool thing that I did for her crowns. And that was how I started using Easy Crowns.
Tell us a little bit about you actually attended Sprigg University, and you did it more than once.
That's right. Absolutely, absolutely. So 2015, I started and I was just dabbling. I would put the crown when they asked for. And I was like, I don't want to do that. I want to be a master. And you don't become a master by doing it sometime when when it happens. You don't do that. So I went full out. First, before attending Sprigg U, I hounded every YouTube video there is and I read a lot. Okay. And then what happened was I met you guys in 2016 and I took my first Sprigg U. And I remember Dr. Mark, and fantastic. He's a fantastic doctor. He's done a lot, a lot, a lot. I can ask him all my questions. And even when I started buying your crowns, I would ask your salesperson, this happened the other day. I had a crack. What do I do? And it's okay. As a pediatric dentist, I think our biggest concern is failing our patient. And I was just outright honest, like, you know, things like that happen. I'm so sorry. I'll reimburse you. I'll do this. I'll do that. And my patients loved my honesty. They didn't take it too seriously. I didn't over promise and over deliver. I under promised and over delivered, and that the trick for me. And when I did that in 2016, and I started, at 2017, I started giving my patients under general anesthesia, crowns, front teeth only. Comes 2018, I started doing anteriors and posteriors. And then I was like, you know what? I want to become good at time. I want to do it every time, all the way, the best way. I want to do it in 3 minutes. I want to do it 4 minutes. I started giving myself targets. And that's when I came to Sprigg for the second time. And in that time, I knew everything and I did so many. I just wanted to become a master, you know. The other day, I was cementing a crown, okay? Completely cooperative kid, happy, everything is good, good, good. I did it in, top to bottom, 6 minutes, everything is good. The last few seconds, I tried the crown, fits perfectly. From the first time, I was just about to cement it. I think the mouth prop impinged something and I put it and he moved. And after cement wipe off, because I just after cement wipe off, I discovered that the crown is not singing. It was like this because he moved at the time where I was pushing it in. And of course, the cement covered the margin. And I'm like, open margin, what am I going to do? And the kid has had it. He wants to go. So I explained to the parents, doesn't look good. It's okay. I'm going to replace it. Give me 2, 3 days. Let's work on him again. And he came back a few days later. I took it off, 2 seconds, put one back in. Happy kid, happy everything. So things like that happen, and that's why an advanced course with a pediatric dentist who's done, mistakes and problems and faced challenges is where, the real phase two growth starts. You know what I mean?
Yeah, I hear a lot of people say that, and that's one of the things I'm always encouraging people to do. Even if you've done 2 crowns or if you've done 200 crowns, if you come to Sprigg University, you're going to learn more every single time you take it. A lot of people are like, well, I've already taken, I know everything. And while you're good at what you're doing, you're going to be rubbing shoulders with instructors and with other people in the course that have done hundreds of crowns. And it's those little details that you learn that actually are pretty beneficial. I get feedback from. So that's my encouragement to everyone that has not taken the course is take the time. You will definitely be happy you did. Why is it important to offer innovative products? There's a lot of them on the market today, not just easy crowns, but why is it important to offer innovative products and services to your patients? What is it that you feel is so important about keeping up to the cutting edge in technology in pediatric dentistry?
Well, I love your question. For me, it's a no-brainer. Again, it's the same concept. I want to be a master. I don't want to do a so-so filling. I want to do the best filling that stays for the longest period of time. I want my patients the happiest. I want to offer my patients more and more and more. And I don't want to be dealing with the parent that's like, oh, but the filling broke, but I had to come back. And I want the patient that goes and raves about me, that gives millions and millions of reviews, that actually most of my patients are word of mouth. And they would wait for a month waiting period to see me. And that is why I would love to provide the cutting edge technology that they would have to travel from Oman, from Iraq. The other day, I had a patient. Now we're during COVID, right? They had to travel from Iraq for 2-3 days. They booked.
Wow.
They have everything prepped, everything ready. So they booked, they come, they left. Kuwait, again, we're during COVID. So before COVID, after COVID, it doesn't matter. People would still travel to come see me, do quarantine, do everything to come
Doesn't
see
that
me
make you
and
feel
give
amazing?
their kids. It does. Absolutely. From Tanzania. I've had lots of patients from Africa who can't get treatment otherwise. And you know what? The other day I had a child on the autism spectrum. They've come from Africa. They don't want medals. They have a story of their own. And I was like, this is what I do. And they were so happy with it. And guess what? That boy, he's 7. He sat nicely with the laughing gas. I put 2 crowns. 20 minutes from top to bottom, nitrous, everything. And he was super happy. He was just happy. The mom was happy. That's, Jeff, we are in the business of making kids happy and healthy.
Yeah.
That's why we do what we do.
Well, I see it in your face every time I see you. You've got that smile. You've got that bubbly personality. You are an amazing pediatric dentist.
Stop. Stop.
Well, thank you for taking the time to be with us this morning. Have questions? Got clinical challenges? Feel free to reach out to me anytime at AskJeff@SpriggUSA.com. We'll see you next time.